Good afternoon, everyone. I'm Erica Harquist, a Media Public Information Officer for the Oregon Health Authority. Thank you so much for joining us today. Today, we are providing an update on the very latest developments in the COVID-19 pandemic here in Oregon. We are joined today by OHA Director Patrick Allen, Colt Gill, Director of the Oregon Department of Education, and Dr. Dean Sidelinger, our State Medical Officer and State Epidemiologist. So this is an opportunity for members of the media to ask their questions and hear from our experts. The public is encouraged to ask questions during our Facebook Live events. And while these Zooms typically allow for recording, today it isn't. So we want to let all of you broadcast media members know that we will have this video and the talking points provided in today's daily media release. That'll come out later this afternoon. And I'll be turning off my camera now. And at this time, I would like to ask members of the media to raise their hands after we hear from Director Allen. But first, to get started, let's hear from Director Allen.
Good morning. Again, I'm Patrick Allen, Director of the Oregon Health Authority. We'll be updating you today on the latest developments in the COVID-19 pandemic, as well as sharing information about new test-to-stay protocols in our schools that'll allow students and staff to conduct in-person instruction as safely as possible while reducing the burden of quarantine on students and their families, teachers, and school administrators. But I want to start today with another policy announcement. OHA is lifting the requirement for outdoor mask wearing in crowded settings. This rule was implemented back in August at the peak of this most recent surge. This decision, which takes effect immediately, reflects the overall progress we've seen on the COVID-19 front here in Oregon. And it's a testament to the perseverance of all Oregonians in faithfully adopting the public health interventions we know are effective in containing the spread of the disease. OHA is taking this action within its legal authority after close consultation with Governor Brown and her advisors. This new mask guidance should not keep people who want to continue wearing masks in all settings from doing so. The use of face coverings provides significant protection for people who are not vaccinated. Masks also provide additional protection against the small risk of infection that exists for vaccinated individuals. They protect the person wearing the mask as well as those around them. Mask wearing for people who are unvaccinated, or for the elderly, or for immunocompromised people, or people at higher risk of contracting the disease, and for people who are living with someone in one of those categories is still strongly recommended. And mask wearing is still recommended for people who are in crowded outdoor settings for an extended period. In a few moments, Director Gill will talk about how the mask requirements will be implemented in schools around the state. Recall where we were when the mask regulations were first implemented last summer. Our daily cases were numbering in the 4 digits, and our hospital census was more than double what it is today. We took decisive measures, and as has been the case over the course of the pandemic, Oregonians resoundingly responded. Together, we've managed to turn back the tsunami of new infections that very nearly swamped our healthcare system. Our collective adherence to these life-saving measures has spared Oregon from the extreme impacts experienced in other states. Oregon is the 4th lowest in cases and 6th lowest in deaths nationally. Over the past 6 weeks, we've continued to see a slow but steady decline in daily cases and hospitalizations, consistent with recent modeling projections. Our 7-day moving average of new cases as of yesterday was 822. On September 1st, in the teeth of this current surge, that average was 2,285. That's a 64% decrease. OHA's most recent COVID-19 weekly report noted a 12% drop in new cases for the week ending Sunday, November 14th, although that decline has been slowing in recent days. That week followed a 16% decline the previous week, when OHA reported the fewest weekly cases since mid-July. Likewise, patients with COVID-19 who are in hospitals, along with intensive care patient counts, have declined, falling from a peak of 1,178 on September 1st to 404 as of today. Also, Oregon's total population vaccination percentage has grown with the recent authorization for children aged 5 to 11 to receive the Pfizer pediatric vaccine. 8 in 10 adult Oregonians have now received at least a single dose of the vaccines available to protect us from COVID-19. Oregon ranks 19th among states for the percentage of population who've received at least one dose of a vaccine, according to the Centers for Disease Control and Prevention. We also rank 19th among all states and the District of Columbia in the administration of booster doses. As of today, more than 56,000 5 to 11-year-olds have received at least one vaccine dose, which accounts for nearly 17% of all children in that age range. Although the COVID-19 landscape is markedly improved, we are not yet at a point where we can consider relaxing the guidance on wearing masks in indoor public settings. The Delta variant remains a significant threat to all of us, and especially to the 1 in 5 Oregonians who are vulnerable to the disease. While the outlook has improved, we're still experiencing daily cases and hospitalizations at or near the peaks of previous COVID-19 surges. We're still dealing with limited hospital capacity for all patients. Just yesterday, we announced the extension of approximately 1,000 health professionals to support overburdened hospitals. Unvaccinated people continue to account for an overwhelming majority of our COVID-19 hospitalizations. Our most recent breakthrough case data indicates that unvaccinated people are 4.5 times more likely to contract the virus. And we continue to see a concerning pattern of COVID-19 spread throughout the state, with the heaviest concentrations found in counties with lagging vaccination rates. On Friday, as you know, the FDA approved booster shots for people 18 and older. That means if you're more than 6 months removed from a second dose of the Moderna or Pfizer vaccines, or 2 months beyond the single dose Johnson & Johnson, you're eligible for, and you should strongly consider getting, the additional protection afforded by a booster shot. It's especially important for people who are 50 or older to get a booster, as well as people who live in long-term care facilities, work in jobs that put them at high risk of exposure, or who have experienced health inequity, such as people of color or members of a tribe. I want to emphasize that the existing vaccines provide substantial protection against the virus. So you might ask, why are we recommending that you get a booster? It's because immunity can wane over time, and the additional dose can provide sometimes greater protection than the initial dose. Also, even though you're at low risk of getting infected, if you do get the disease, you can pass it on to others who are unvaccinated, or someone who's elderly, or someone who's immunocompromised. In these early stages, we may need to show some patience in scheduling with a vaccine provider as they ramp up to meet the new demand. Over the holidays, it's especially important that we maintain the vigilance that has served us so well. The decisions we make over the next several weeks will determine whether we can continue the progress we're experiencing now, or whether we fall deeper into the grip of this latest surge. We can be heartened that the arriving holidays are likely to look more like 2019 than 2020. But there are measures you can take to protect yourself and the people around you. This holiday, you're at less risk if you're vaccinated and if you get a booster when the time is right. Smaller gatherings are less risky than large gatherings, especially indoors. Wear a mask if you're indoors with people who may not be vaccinated, especially older adults, or if you're around people who may be immunocompromised or people with higher risk of complications from COVID-19. Finally, I want to acknowledge the sad milestone of Oregon's 5,000th COVID-19 death, which was surpassed yesterday. Each death represents a hole in someone's life that will never be filled. Too many Oregonians will see empty chairs around their holiday dinner table, making this tragic milestone even more heartbreaking. Each death represents lost love, laughter, and memories for family and friends. And my sadness is only compounded by the knowledge that nearly all the recent COVID-19 deaths could have been prevented by vaccines, which remain our best protection against serious illness and death. I strongly urge every eligible Oregonian to get vaccinated if you've not done so, and to get a booster shot as soon as you can. Do it for yourselves and for your loved ones. Do it for your neighbors and for your colleagues. Do it for your communities and for all Oregonians. Getting vaccinated and then getting a booster shot are important steps in our journey to return to normal. To everyone who has taken the time and effort to get the vaccine, and for the people who will soon take advantage of a COVID-19 booster, thank you. I wish everyone a safe and healthy Thanksgiving. Now I'll turn things over to Director Gill.
Thank you, Director Allen. Now, our North Star this year has been to safely and reliably hold school in person every day for every student all year long. We know the majority of our students learn better in person. We know our kids want access to their friends and peers. We know children and families rely on a stable, safe, and caring school environment for many, many reasons. Some rely on our schools for a solid breakfast and a warm lunch each day. For families, consistency matters. School is a way to ensure that they can go to work and support their family. For these reasons, it is our highest priority to keep our students safely learning in person every day. Today, we are introducing a critically important new protocol aimed at helping us achieve our North Star goal. This can be achieved for our students, educators, and their families. The Test to Stay protocol will be available to most public and private schools in Oregon right away. And my hope is that every school and local public health authority find a way to partner and implement this protocol to preserve the continuity of teaching and learning in our schools. Let me be clear, though, that vaccination is by far the best and most effective protocol for preventing the spread of COVID-19, for reducing the impact of the disease on individuals, and preventing lost learning time. Vaccinated individuals without symptoms are not required to quarantine when they become a close contact with a COVID positive individual. Vaccination works in all settings and is key to accessing a stable in-person education. Now, the CDC considers Test to Stay a promising practice, and Test to Stay can help unvaccinated students and staff maintain regular school attendance as well. Test to Stay modifies quarantine protocols when students and staff are exposed to COVID-19 in the school day setting, where many other protocols are in place to stop the spread of COVID-19. Things like physical distancing, universal indoor face coverings, airflow and ventilation, and more. This protocol can be used for the unvaccinated when exposed in the school setting and when they are not exhibiting COVID symptoms themselves. Test to Stay allows our students and staff to take free COVID-19 tests at school in the days following an exposure. And if the tests remain negative, they can continue to stay in the school setting and even participate in extracurricular activities while wearing a face covering during the 7-day quarantine period. Outside the school day, the student must quarantine at home for that 7-day period. This new protocol will greatly reduce the number of students who miss school due to quarantines. It will not resolve all of our quarantine challenges. We look to vaccination as the key to virtually eliminating quarantines, because Test to Stay may not be used following extracurricular exposures, because masking in those settings is optional and the risk of transmission within the cohort is greater. Similarly, Test to Stay may not be used following community or in-home exposures for the same reasons. Test to Stay will be an essential tool for maintaining stable access to in-person learning. Nearly every school in Oregon is already signed up and is well practiced in the program because it uses the OHA diagnostic testing program that has been in place since last spring. Currently, about 170 of Oregon's 197 school districts make use of the OHA diagnostic testing program. We are busy contacting the remaining districts to ensure that they have access to register for that program or have another source for their testing so that they can also implement the Test to Stay protocol. The success of Test to Stay hinges on 3 factors. First, each school's continued fidelity in implementing layered protocols to reduce the spread of COVID-19. Schools must continue to universally require face coverings indoors, maintain physical distancing whenever possible, reduce close contact time between individuals, increase airflow and ventilation, provide for frequent hand washing, and more. These efforts are reducing the possibility of spread in the school setting and make it possible to modify the quarantine with the test to stay protocol. The second factor is a stable and adequate test kit supply. We believe we now have an adequate supply to start the program here in Oregon. We have heard from our federal partners and from manufacturers that the supply will be stable and will remain adequate. However, we all know in this time that supply chain issues can be problematic, and a nationwide COVID-19 surge could impact the supply. Either of those things could cause a pause in availability in the future. The final factor is in each school's ability to fully administer the program. Our school's priority is a safe and reliable education. Our school staff are educators first. They are taking on many new and demanding roles during the pandemic, and I'm deeply, deeply, deeply proud of what our educators have accomplished for our students and families during this time. This is one more ask of our educators. While federal dollars help, our schools remain short-staffed in many cases, and every individual is giving their all to ensure that our schools are operating each day. Some schools may seek volunteer support. Please give of your time if you're able. Implementing this protocol ensures more of our students can access their education with stability through this ongoing pandemic. Our plan is to maintain this program throughout the school year. If our students vaccinate at high rates, we can reduce the need for and the stress on the test to stay protocol. If we see very high rates of student vaccination in the future, at some point, we may no longer need this protocol. I hope every family is taking steps to vaccinate their children ages 5 and up as soon as they're able. It's free, it does not require insurance, and immigration status is not a factor. Okay, finally, I want to discuss one other change that is being made today. As the Oregon Health Authority eliminates the statewide outdoor mask rules, a new authority and responsibility is falling on the shoulders of school leaders across Oregon. Outdoor face coverings will no longer be required by the state in school settings. Any school rules for outdoor face coverings now fall under the authority of the local school district, charter school, or private school leader. Outdoor transmission of COVID-19 is less likely. However, it is still dependent on the situation. Tents with walls on multiple sides are not really like the outdoors with full air circulation. Students choose many activities during their breaks and during recess time. Like most of us, they spend this time with the same group of friends day after day. If they're running and playing and generally maintaining good physical distance, removing face coverings is not likely to greatly increase their risk of exposure. However, if they spend this time at a table or on a bench, playing a game with a friend and visiting with others in close proximity during their recess or break times throughout the day, it would still be wise to wear a face covering. Please look to your school leadership for protocols on outdoor face coverings in the coming days. They will be considering the size of their space for students outdoors, the age of their students, the number of students that they serve, and the various activities their students will be participating in. They will be basing their decisions on the best way to preserve safety and learning time for their students. Please follow their direction and support stable access to in-person learning for each and every one of our students. I want to thank you for your time today, and we're happy to begin taking some questions.
Thank you so much, Colt. And we just want to remind our members of the media who may have joined late that the Zoom, there is a bit of a Zoom glitch, but we will be sending out a link to today's Zoom shortly after it's over in today's daily media release. If you have a question, please raise your hand and I'll call on you. And with that, our first question comes from Will with KPTV. Will, go ahead.
Okay, thanks for taking my question. So I believe this one would be for Director Allen. I want to know in the most recent data, if you've been able to figure out anymore, if there are certain types of people that are more at risk right now for getting COVID-19. Any further demographics you can explain more as to this is the group that's more at risk?
Yeah, I'll take a quick cut at that and then pitch it to Dr. Sidelinger for a more detailed answer. I would say, obviously, the demographic that is far and away at the most risk of contracting COVID are those who are unvaccinated. I think if you then look at breakthrough cases, the people who were recommending most strongly receive boosters are those who are more at risk, people who are older, who are in congregate living, and who are immunocompromised. Dr. Sidelinger, do you want to go into some detail on that?
Thank you, Director Allen. Certainly, vaccination status is your biggest risk. If you're fully vaccinated, you're at significantly lower risk from getting COVID and also from getting hospitalized with severe disease. The next best predictor is age. Those over 65 are more represented in serious cases, even if they're vaccinated. Those over 50 as well have a higher rate of serious disease. And those with underlying conditions that make them more prone to complications are more at risk for severe disease. But vaccination, something we can all choose, is your biggest predictor of those who are going to get sick with COVID, those who are going to be hospitalized with COVID, and those who may die with COVID.
Thank you, Dr. Sidelinger. Thank you, Director Allen. Our next question comes from Gary Warner with EO Media. Go ahead, Gary.
Hi, I wanted to find out a little bit more about, you said that these efforts will get us closer to normal. What is the timeline now for something that is close to normal? OHSU had forecast back, I think, at the end of October that a steeper drop in hospitalizations that would actually pretty much flatten out to zero by about now. And here we are, not close to that. When are we going to get down to a point where a new normal, but a normal is going to happen in Oregon?
Well, Gary, I think I'm not sure if you're asking me when the pandemic is going to end, which I'm not remotely going to even come close to trying to predict, or if you're asking me when we transition from kind of a pandemic mode to an endemic mode, which I think is probably I can't put a date on that either, but I can, we can talk about what that looks like.
It's definitely the second one is what I'm asking. When are we going to get back to something like where we were at the end of June?
Yeah, and so I think we're going to need to be at a place where we have much less transmission of disease, much less hospitalization. We're still sitting over 90% of hospital beds full. Same thing with ICU beds. Still a large portion of those ICU beds occupied by largely unvaccinated people suffering from COVID. We need to get out of that part of this phase and get to something that looks a lot more like flu. A bad flu season kills 600 Oregonians in a year. As I talked about in my comments, over the last nearly 2 years now, we've lost 5,000 people to COVID. So I think we need to get to something that looks much more like that, with a relatively low rate of transmission, a relatively high population-wide rate of vaccination, and not nearly the same level of stress on the medical system that we're currently experiencing.
Any kind of time frame, if current trends continue, where we would get to that?
I would not want to even try to hazard a guess, for the very reason that you brought up in framing the question, that the last attempts were woefully wrong.
Okay. Thank you very much.
Thank you,
Can
Gary.
Can I add a little bit to not predicting the timeline, but what we've seen is, while our peak of folks in the hospital right now, fellow Oregonians who are sick with COVID, is about 2/3 of the winter peak, it is still very high. And our modeling from OHSU and Dr. Graven has shown that the decline in folks in the hospital during the remainder of the year has slowed. This disease remains incredibly unpredictable, and we've seen over 30 states now seeing significant increases in COVID. Oregon isn't there yet, but we look at those other states, And we know that that could be in our future. So these measures of getting more people vaccinated, which is our best protection, and continuing to wear masks in indoor public settings are with us for the near future as we move into the winter, when influenza, as well as other respiratory viruses, will be circulating at higher levels along with COVID-19.
Again, thank you.
Well said. Thank you very much, Gary. Okay, our next question comes from Rachel Monahan with Willamette Week. Go ahead, Rachel.
I have a technical question here. It sounds like you'll be using antigen tests for test to stay. And given that I assume that these children will be asymptomatic, is OHA finally ready to say that these tests are effective for testing asymptomatically?
Thank you, Rachel. I'll go ahead and take that question. In the launch of Test to Stay, we will be using rapid antigen tests. These tests perform better when the person is more likely to have disease. So that includes people with symptoms of COVID-19, as well as those who are exposed. So students and staff who participate in a Test to Stay program have had an exposure at school, which increases their risk for COVID-19, and therefore the antigen tests can be used in this setting and predict and can pick up those individuals who have COVID and are likely to spread it to others. We use these antigen tests in school as a way to shorten quarantine in those individuals who are exposed but have not developed symptoms by testing them at day 5 to 7 and allowing them to return to in-person instruction at a shorter time period. So yes, these antigen tests don't perform well in those without symptoms, without exposures, but we're using these tests in folks who either have symptoms or have had an exposure, and they perform very well.
I'm sorry, what's the difference between a test performance when there's been an exposure and there hasn't been? I don't understand how that could technically be true.
The person who's had an exposure, similar to a person with symptoms consistent with COVID-19, has a higher likelihood of having COVID-19, and these tests perform better in those situations.
But I don't understand why OHA wouldn't be using that for test screening if you consider it effective enough to use in a Test to Stay program.
Can I take a shot?
Sure, and then I can.
Yeah, it's a math function. it's basically the percentage chance that someone is positive and the ability of the test to pick that up. As the percentage chance that someone is positive goes down, the test gets less effective. And so when you use it in a pure screening environment, you have fewer people who actually are positive that you're testing amongst. When you look at a population that has been exposed, you have more people in an exposed population who actually are positive. And so the test it works better because it's testing, testing amongst a higher percentage of positive cases. There are a couple of good papers on this that we could try to send you that I think could help.
Dr. Sidelinger, is there anything else you wanted to add?
No, I think Director Allen laid out the difference between screening, which is typically done with folks without exposure, without symptoms, and that's where use of PCR tests, remains a lot more valuable in picking up disease. But in situations where folks are exposed or have symptoms consistent with COVID-19, the antigen tests perform very well.
Thank you. And thank you, Rachel, for that question. Our next question comes from Lisa Balick, who has a question about lifting the outdoor mask mandate. Go ahead, Lisa.
Yes, good morning. I'm wondering why lift the outdoor mask mandate at this time? And there are several upcoming crowded events like Lines to See Santa, Christmas tree lightings, large events that incorporate a lot of children, mostly who have not been vaccinated. Why not wait until, say, January to do that?
Thank you for that question, Lisa. I think what we know about transmission of COVID-19 is that it is much more easily transmitted in indoor settings. Outdoor crowded settings where people are together over a period of time, particularly if they're unvaccinated, can present a risk. But we know that those indoor settings present a much higher risk. So we encourage all to get vaccinated that will make all of your activities, whether indoor or outdoor, safer. But the transmission in these settings, especially when contact is fleeting, even if people come together, has significantly lower risk. So we're asking people to assess their own status. Are they vaccinated or not? Is there anyone in their home who's unvaccinated? Are they immunocompromised or live with folks who are immunocompromised? And they may make a different decision about attending an outdoor event where not everyone is masked. But if people are vaccinated, there's no one at risk for serious disease at home. They can feel comfortable going to these settings, not wearing a mask, and having fun celebrating the holidays.
But I guess just to follow, why there was a decision to make it now as opposed to January after these events?
Let me take that. I think an outdoor mask requirement was an unusual step. There were relatively few jurisdictions that did that anywhere. We did that at an unusual time in the pandemic for Oregon. I went through some of the numbers in my statement about how extremely high our cases and our hospitalizations were at the point that we put that requirement in place. We're not at that place any longer. We're at a place that looks much more like our previous surges where we didn't implement an outdoor mask requirement. And so we're moving back to something that looks more, that is more calibrated to where the actual case numbers are. We're taking advantage of the progress we've made and acknowledging that now. And that's why we've made the decision to make that change at this time.
Thank you.
Thank you, Lisa. Our next question comes from Rachel Alexander with the Salem Reporter. Go ahead, Rachel.
Hi, thank you. I'm wondering if you could provide some more detail on the test to stay protocol. I'm wondering how frequently students would be tested during that week period, if it's just one time or daily, and how that differs from the current process for unvaccinated students as far as the quarantine period. And then also when you expect that capability to actually roll out into school districts, if that'll be immediate or take some time.
Dean, do you want to go ahead?
I'll start and then hand it over to Director Gill. For our test to stay protocol, we have implemented it using the rapid antigen tests that are already deployed across about 80% of schools here in Oregon. Some schools will be able to implement the protocol right away with their existing supplies. Other schools may need some time to ramp up supplies or increase their capacity for observing the collection of the specimens and doing the testing. And so we continue to work with our partners on that. Folks participating in the test to stay program will be tested twice, once soon after exposure, and that test can be done at school before they're sent home if they're identified while they're at school. And the second test being done at day 5 to 7 to allow them to stay in school for that 7-day period. Doing tests twice during that week-long period should pick up the vast majority of students who are exposed, who may come down with COVID-19, and allow them to safely participate, not just in classroom settings, but in other structured educational settings while they're wearing a mask, without missing out on that in-school, in-person experience that they're having this year. Director Gill, is there anything you'd like to add?
I think that covered most of it, Dean. Thank you, Dr. Sidelinger. I think the one thing I would add is just to note that each school district and school in Oregon is in a different place in terms of their staffing, the number of students that they support, the programs that they offer. And so each one of them will need to take a look at how they're going to ensure that they have not just the supplies ready, but the staffing available or the volunteers available to implement this program. So we will be asking that they immediately begin conversations with their local public health authority about the use of this program, that they look internally to determine how many test administrators they have trained in the current OHA diagnostic testing program, and consider adding more trained test administrators to their programming, and develop protocols for what will likely become some pretty regular testing at schools, more so than they do today. We really do believe that this will significantly reduce the impact of lost instructional time due to quarantines. Quarantines in Oregon have impacted students on a range of anywhere from 14 days to 7 days of quarantine per exposure that they experience. And that's really challenging to maintaining a stable education and regular access to school. So we really do think this will be a turnaround for our students and families and educators.
Thank you, Director. Okay, next question comes from Jim Ferretti with KXL. Go ahead, Jim.
Director Allen, can you bring the public up to date on what is apparently known as the COVID-19 digital vaccine record? We understand there was an event held yesterday, another one scheduled for next Tuesday for feedback, yet it doesn't appear on the OHA as requesting feedback from the general public. So can you tell us what this program is, what's the expected start date, and whose feedback is the OHA requesting?
Yeah, so what the digital vaccine record is an effort to provide people the ability to easily get a QR code to demonstrate that they're vaccinated. There are lots of venues and organizations today that require proof of vaccination. Large sporting events around the state, Blazers, for example, require that. And if you have a healthcare provider that's got one of the common electronic health record systems out there like Epic or some others, you've got the ability to, with a couple of clicks on your phone, be able to download proof of your vaccination that's verified by your healthcare provider that the venue can easily use to be able to check that. What we're trying to do is provide that same easy capability to people who don't have easy access to an electronic health record. So people who've been vaccinated by our pop-up FEMA vaccine trailers, our field operations staff who've gone out to work with farm workers, ag workers, those kinds of things. People who are less connected to the healthcare system, so that so they've got the same ability to get that proof of vaccination and be able to easily demonstrate it. It's got both a digital phone component as well as a paper printable document component to it. And what we're doing is basically doing outreach with those underserved communities that are not well connected to the system to make sure we're meeting their needs and trying to develop this set of tools that would be this digital vaccine record. What we're not planning on doing is any kind of a requirement that there are settings where people must show proof of vaccination. What we're trying to do is accommodate those entities that do have their own requirements and make sure that people have got easy access to their record.
Thank you, Director Allen. Thank you, Jim. Our next question comes from KGW. It's regarding vaccine accessibility. It's from Galen Etlin. Go ahead, Galen.
Hi there. Yes, we fell victim to the Zoom glitch, so I'm using a coworker's account. We appreciate the flexibility. We were wondering, with the influx of people newly eligible for a COVID booster, we're hearing from a lot of people who are struggling to get an appointment in the more largely populated areas around the Portland metro. And we know it's a little bit different in other parts of the state where it's maybe more accessible. What plans, if any, are in the works to potentially roll out, streamlined processes like we saw earlier in the year with, mass vaccination sites or things along those lines?
Yeah, I can tackle that. We've got some what I would call maybe not mass vax, but mid-vax sites that are up and running at Tectonics in Washington County, at a former, I think it's a Kmart out in Gresham, some other sites that are not quite as large, but are able to do drive-up vaccination and those kinds of things. But the hard reality is those very large-scale vaccination sites that we had almost a year ago now. We're dependent on the National Guard, on state hospital systems, and on other providers who are still swamped with COVID cases right now. And we just don't have the human resources to be able to roll out vaccination on that kind of scale. And so we are, I think we are doing a large amount of vaccination right now, but it is going to take a little bit of time. And people, if they go out and look for appointments now, it may be a bit of time before they're able to get those appointments. With kids, we're working with school districts to try to set up vaccination opportunities in different school settings to try to help offset that. But what I really expect to have happen is the pattern that we've really been in since about last summer, which is a big burst of interest for a short while, and then those people get through the system, and the demand gets much more manageable pretty quickly. Now, you observe that this is really a phenomenon that's got some geography to it, and if you do have the ability to travel just a little bit, I think you can find more availability in other parts of the state where the demand isn't quite as high as it is in the Portland area or other parts of the valley.
Thank you.
Mhm.
Thank you very much. Thank you. Okay, our next question comes from Fedor Zarkin with the Oregonian. Go ahead, Fedor.
Hi, thanks for taking my question. So does Oregon currently have targets for when it will lift the indoor mask mandate? And if not, why not?
We don't, because we're not remotely close to it, our being able to identify what those targets should be. We're still verging on swamped in our hospital systems. 1 in 5 Oregonians continue to be vulnerable to the virus. Our case counts are at levels that are similar to what they were in our previous peaks. We will need to set targets, but we really need to be able to set them based on the circumstances at the time that we set them, and we think that we're weeks away from being able to do that.
So what is your target for being able to set a target for lifting the mandate?
I think we need to get to a place where hospitalization or hospital capacity is not as critically overloaded as it is right now.
Well, how are you defining not critically overloaded then? What is that target?
Less than we have now.
How much less?
I can't answer that, Fedor. It's a judgment call that we need to take into account a number of circumstances and look broadly at capacity of our systems, the trajectory of cases, how many there are, whether they're going up or down, and most importantly, emerging issues. I think we really got caught the last time we set a bright, clear metric by the emergence of the Delta variant and the fact that it was far more contagious than experts had been expecting before it arrived. And I think we want to try not to get caught by emerging circumstances in the same way.
Okay, so part of this is in anticipation of a potential variant that would recreate the situation.
No, I think you're over particularizing what I just said. I think we're cautious about emerging issues. The last emerging issue was a new variant. There could well be others. There can also be emerging issues to the positive side. We've got a couple of antiviral medications that are in the approval process through FDA, and broad availability of those could be a positive development that would kind of argue the other direction. We don't, because they're emerging issues, we don't know what they are. We want to be in a more stable place than we are in the system to be able to then consider what those circumstances are at the time.
Thank you.
Mm-hmm.
Thank you, Fedor. Our next question comes from Dick Hughes with the Oregon Capital Insider. Go ahead.
Thank you very much. I'd like to piggyback on the last question, also a previous one from Gary Warner and Director Allen and Dr. Sidelinger. Given that it's very unpredictable, can you give a sense of what you think will be the long-term way we deal with this epidemic? Will it be continuing to get booster shots periodically, just like we get flu shots regularly? Will it be that masks are advised, which also are a good protection against the flu and colds? I'm looking for what normal might be like in our society.
Thank you, Dick, for that question. I think, as we move forward, we know that our safe and effective vaccines are really helping to change the face of this pandemic. They are cutting down the folks who are getting sick. They're cutting down the folks who are in the hospital, and they're cutting down the folks who are dying. So the more we can get vaccines into arms, the better off we'll be. Whether boosters become an annual thing, or this is this initial booster is kind of finishing a series and giving people longer lasting protection, we'll have to continue to watch that. But certainly vaccinations are our best way out of this. And as more people across the world are vaccinated, that decreases the possibility of a new variant that we would have to face differently comes into the United States or comes into Oregon. What we've seen with masks, our masks are very effective, especially in indoor public settings at reducing the spread. Many countries and communities have used masks pretty routinely during the winter and during flu season. That's not been the norm in the United States. but I think we can expect to see more people as we go through the winter, next winter, potentially donning masks when they're in grocery stores and in indoor public places. That along with vaccination are effective protective measures. But as more people are vaccinated, as we have hopefully effective antiviral medication that can prevent serious complications, and as disease rates are lower in the community, most activities will be fairly normal, and people will choose which activities to participate in, whether they want to wear a mask, and how they'll protect themselves, their family, and their loved ones they return home to. I anticipate, this winter, we will still see people wearing masks. We will still see many people getting their first shots and their booster shots. But as we move into warmer months, if the disease rates continue to slowly decline, that will go into a place where those masks become much less visible and where people aren't thinking about COVID-19 as much as they are now.
Thank you, Dr. Sidelinger. Thank you, Dick, for the question. Our next question comes from Connor McCarthy with KPTV.
Hi there. I just want to go off the previous questions. I just want to know, why has OHA steered away from, outlined metrics from the public? So at the beginning of the pandemic, you guys had, outlined, if a county has a certain case number, they're in a certain zone, and if they reach this case number, then stuff can open up. But since the summer, it seems OHA has kind of steered away from outlined metrics from the public. I just want to know, why is that? And what can you tell the public about, the future of, indoor mask mandates? I know you guys have mentioned there needs to be a lower case level, lower hospitalizations, but what exact number can you tell the public that needs to be so they have something to look forward to?
Yeah, so we don't have an exact number, and I want to be clear, it's not like we have an exact number that we're keeping secret within OHA and not telling people. We've not set targets. And I think what we've learned over the course of the Delta variant is that the coronavirus is getting more, not less predictable. Nearly 2 years ago when we were, or a year ago when we were setting risk metrics and those kinds of things, we were in a relatively stable period for a number of months. And those kinds of metrics were much more useful to try to identify what kinds of steps needed to be taken. But Delta has really changed that equation. The mix of who's vaccinated and who's not has changed that equation. And so what we're really trying to do is to be careful, you phrase it in terms of giving people a target to shoot for, but we also don't want to create false expectations. We don't want to, set a metric today that looks good today, but a month or 2 or 3 or whenever it is from now, all of a sudden turns out to be the wrong metric and we have to change it. And then what people feel, I think, is a sense in some cases of betrayal, that they hit that metric that we thought was the right metric and turned out not to be. And so I think we want to be cautious before we do something like that. So I think the best guidance that we can provide is that people should expect to continue to be wearing masks indoors for some while, certainly into next year. But beyond that, I don't think we know enough to be able to set a useful target at this time.
All right, thank you.
Right, and just a reminder to please lower your hand after you've asked your question. Okay, our next question comes from Elizabeth Miller with OPB. Go ahead, Elizabeth.
Thanks, Erica. Just a couple of quick clarifying questions. One, what would happen to students in days 2 through 5 or days 2 through 7 between the two test to stay tests? And then just a clarification on how many schools and districts are on board with test to stay already. Colt, I think you said 170 signed up for diagnostic testing. Does that mean they're automatically signed up for test to stay? If you could just explain that a little bit. Thank you.
Yeah, thanks, Elizabeth. So yes, if you're signed up, if a school district or a private school or charter school is signed up for the diagnostic testing, then they already have access to the test and can implement the test to stay protocol. They do need to work with their local public health authority to ensure that everyone is on the same page and is ready to support that modified quarantine. And we call it a modified quarantine because there still are quarantine protocols that the student is going through. So if a student, again, is exposed in that school setting where universal indoor masking is in place and they are not symptomatic, then they take that first test and they get to stay at school. So they get to continue to participate in daily school activities. They can also participate in extracurricular activities as long as they're willing to wear a face covering. When they're at home, they're in a regular quarantine. So in the community, in the home setting, they should be quarantining as if it were a normal quarantine. We're able to allow them to come to school because we have all these other mitigation efforts in place. This is what would happen in between the two tests that you named, the 3 to 5 days between the two tests. They would be participating at school as long as their test results are negative from that first test. If their test results were positive, then they would go into isolation and follow the recommendations of their doctor and the local public health authority. Dr. Sidelinger, anything else on that?
No, I think that covers it. Test to Stay is really designed for those students who are exposed in a structured educational setting. The transmission is lower, so they can be tested after the exposure is identified. As long as they remain symptom-free, they can still participate in those school activities while they remain masked, not have to miss school for those 7 days. And when they test negative again at day 5 to 7, they will be allowed to continue participating in school. So this is another option for schools, families, and children to stay more stably in in-person instruction in classroom settings in front of talented teachers.
Thank you both. We have 2 more questions. Both are follow-ups. The next is from William Metzold with KPTV. He has a follow-up question for Director Gill. Go ahead.
Yes, this is for Director Gill. I'm wondering if you've had any further discussions with Director Allen, probably specifically, about lifting an indoor mask mandate within schools, just due to the other effects that does have on students, that it's not a traditional environment. They do have to think about always making sure their mask is on, how that impacts the learning currently within school buildings. It's been a different type of school year, as we heard, just because of these measures they have to take. Have you had that discussion on the other impacts of the protocols that are in place?
Thanks, Gary. That's a good question. The protocols that are in place are what is allowing us to have in-person instruction. And I opened my statement with that being our North Star this school year. We want to ensure that our students are served in person every school day for the entire year. And what's allowed us to maintain that is our school districts and our private schools and charter schools all working hard to adhere to those regulations, which really does help to prevent the spread of COVID-19 in that setting. Schools are a place that is full of close contact. Students are, our younger students are in the same room with the same group of people day in and day out for multiple hours a day. And that can be a recipe for the spread of COVID-19. What we've done is implement a number of protocols and layered them together to help reduce the chances that it spreads from one person to another. It has been so effective that we can now implement this modified quarantine and allow students to stay even if they've been exposed in that setting, because in our numbers here in Oregon, we're not seeing much spread in that particular setting, while we do see it in the school community among students around school, and during sleepovers, carpools, sports, all of those kinds of things. We are continuing to see the spread of COVID-19. So to be clear, the Oregon Department of Education, myself included, Dr. Sidelinger, Director Allen, we talk on at least a weekly basis and oftentimes more than once a week. And we review the data and we talk about what the next steps should be. And we are clearly not at a place where we're ready, especially in a population that is almost all unvaccinated still, to remove face coverings in an indoor setting.
Thank you.
Thank you very much for that question, Will. Okay, our final question for today, our 12th and final, comes from Gary Warner with EO Media. It's a follow-up. Go ahead, Gary.
Yeah, hi. I wanted to ask about the situation in Central Oregon where you're still seeing very high per capita cases in places like Deschutes County, also high in Crook and Jefferson County, while the rest of the state is dropping. They're running about a 9.3 positivity there. Do you know what's going on with that? And as a secondary thing, I wanted to ask, nationwide cases are up 20% in the last, I believe it's 2 weeks. What kind of concern does that give you, not only for Central Oregon, but for the rest of the state? So kind of a twofer.
Thank you, Gary. Let me start. I think, COVID-19 spread, can be unpredictable. The biggest predictor is certainly vaccination rates. And while Deschutes County has high vaccination rates compared to their neighbors, some of those surrounding Central Oregon counties still have lower vaccination rates. And that can certainly, that certainly does contribute to the spread that we continue to see in those counties. We know that people are mobile, people move from one community to another. And so as people interact and those cases are high, they can bring disease back home or into workplace settings. So certainly, we work with all our local public health authorities and healthcare providers on trying to ensure access to vaccines, community leaders to answer people's questions to try and get our vaccination rates up. But they have remained stubbornly high there in Central Oregon. Certainly as I look at other states, what started as, a handful of states and then states along the Rocky Mountains and now over 30 states that are seeing significantly rising cases, we worry that that could happen in Oregon. We don't know what's behind every surge and every increase in cases, the same way we don't know what's behind every decrease in cases. We do know that the steps people take to protect themselves and their families are some of the biggest drivers. So that decision to get vaccinated and have everyone in a household who's eligible vaccinated, and when eligible getting boosted, help to decrease the spread of COVID-19. Wearing masks in indoor public places, and for those vulnerable who are unvaccinated in those outdoor crowded settings, helps to reduce the spread of disease. And as disease rates have come down, the number of Oregonians who are waking up in the hospital coming down from its peak, people will have to look at the disease in their community, assess the people around them, and determine what risks they need to take. But we hope everyone takes those sensible precautions, getting vaccinated when they're able, boosted when they're eligible, and wearing masks in these settings. And that's our way to get these disease rates down, including in Central Oregon.
The only thing I would add to that is I think watching that very concerning, what appears to be an emerging national trend, is a great example of the exact kind of thing that makes it imprudent for us, I think, to try to set a metric right now for some future elimination of masks. The Delta-dominated COVID world is just still really unpredictable. With that, we're about out of time. I appreciate everyone being with us. I do, as we go into Thanksgiving, just want to quickly express my thanks to all the Oregonians out there who have made great sacrifices and taken really strong steps to help us be where we are and help us come out of the current wave, but also save as many lives as Oregonians collectively together have saved over the course of this pandemic compared to much of the rest of the country. Want to wish everybody a safe and healthy and happy Thanksgiving. Thanks, everyone.